Hi, the purpose of this video is to make sure you're aware of the exercises we'll expect you to do after you've had your operation. The exercises themselves are designed to make sure that as your wound heals and it tightens up, that the structures underneath your wound have a chance to stretch, which means you'll be able to regain the function you had before your operation at your shoulder and make sure you've got no loss of range of motion. The general advice we give people after having this type of operation is to make sure that they avoid heavy lifting for around 6 weeks after their operation with their affected hand. If you're a driver, we want to make sure that you're safe on the road, so be able to make sure that you're able to check your blind spots, make sure that you're able to have your hands on the wheel for the length of time of your journey, and make sure that you're able to comfortably do an emergency stop. If you have a drain after your operation, it's really important that you don't lift your elbow above your shoulder, so there should only be a 90-degree angle at the very most at your shoulder to make sure that the drain position doesn't move. If you've got any questions about that, ask your surgeon or your breast care nurse. So we have a booklet, Exercises Following Breast Surgery, that your breast care nurse should give you at pre-assessment. The exercises in it, there's 7 exercises that are in the middle of the book, and there is another one on the back page, so make sure you get them all. You'll be expected to do the exercises 4 times a day, 10 of each exercise for 3 months after your operation. With all the exercises, it's okay to feel a little bit tight at your shoulder and around your wound site. That tightness will move further up within your range of motion as you recover and the inflammation settles. But do not push into pain, because that will limit your ability to do the exercises the amount of times and with the frequency required to get the full benefit from them. If you have any painkillers, it's useful to take these about half an hour before doing the exercises, and that can really help your ability to do them. So the following part of the video will take you through the booklet, and we'll make sure that you're happy with each exercise, and we'll explain it in detail. So exercise 1 in the booklet, trying to get yourself into as good a sitting posture as you can, or standing. So you're drawing your shoulders up towards your ears, rolling them back and rolling them down. So we're going to do that for 10 reps.
2, 3, 4, 5, 6, 7, 8, 9, 10.
Exercise 2 in the booklet, we're looking for you to bring your hand up towards your shoulder and straighten your elbow all the way back out, and we're doing that for 10 reps.
1, 2,
Good.
3, 4, 5, 6, 7, 8, 9, 10.
Good job. You'll notice in the booklet that there's 2 pictures for this exercise. So the first picture, if you've got a drain, it shows, as I mentioned at the start of the video, your arm coming to the 90-degree point, so just coming up to here and back down. So if you've got a drain, just following that the first picture of the exercise until the drain is removed, after which point you're able to lift your arm a little bit further up until the point of tightness. So if you're able to just up until it gets tight and then back down. Okay, and you're doing that for your 10 reps again.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Good. So exercise 4 in your book, it concentrates on your ability to get your arm up and out to the side. There's 2 pictures in the book. The first one is important if you've got a drain, as it was in the last exercise, as you're only able to bring your arm up and out to the 90-degree angle, so only up to there, and then bringing it back down to your side. Once you have your drain removed, you're able to move a little bit further. So leading with your thumb, bringing your arm up and out to the side as far as possible until you hit a bit of tightness, and then coming back down to your side. And you're going to do that for 10 reps again.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Good. If you're finding that exercise difficult, there's a variation. So what you can do is keep your elbow in at your side and keep your hand at a right angle and bring your arm up and out to the side, and it just takes a little bit of weight off your shoulder. So that's a variation if you're finding that exercise 4 particularly difficult.
Okay.
That's fine, thank you. So exercise 5 in the book, what we're going to ask you to do is see if you can get your hand behind your head. So reaching up and back, bringing your hand behind your head, and then bringing it back to your lap. And again, you're doing that for 10 repetitions. So back.
1, 2, 3, 4, 5, 6,
Maybe when you're beginning to find that a little bit easier,
7,
what you can do is see if you can reach slightly further down your back
8,
and increase your range of motion further.
9, 10.
Good job. Exercise 6 in the book is quite similar, but this time we're going to ask you to reach behind your back. So bringing your hand from your lap and reaching behind your back to touch your lower back to start off with, and then bringing your hand back to your lap. You're going to try and do that for 10 reps just now.
1, 2, 3, 4, 5, 6,
And as you get better at the exercise, what you can try and do
7,
is reach further up your back.
8,
This will help you increase your range of motion further.
9, 10.
Good. So exercise 7 in the book, you can either do it against the wall or you can do it lying down. So we'll do it against the wall here. So what we'll ask you to do is bring your hand up towards the back of your head, and you're going to bring your elbow back to touch the wall. You're going to hold there for 5 seconds.
1, 2, 3, 4, 5.
And bring your elbow back in. Give yourself a wee rest. You're going to come back again.
1, 2, 3, 4, 5.
Good. This is going to give you a good stretch into your muscles that are in the front of your chest.
1, 2, 3, 4, 5. 1, 2, 3, 4, 5.
Good.
1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5.
Good. Should you require any further treatment, such as radiotherapy, there's a position that you need to be able to get to. All these exercises will build up to that position. So if you come up with your back facing the wall, bring your arm up to 90 degrees and bring your hand back to the wall to touch and bring it back. And that will be the position you need to get into for if you need any treatment such as radiotherapy. So we advise that you continue with your exercises for the 3 months that we advised you to at the start of the video. However, if you don't feel your shoulder gets back to its previous function in terms of pain, range of movement, then it's important you contact your consultant, surgeon, or your breast care nurse. Either that, or you can self-refer by phoning 0800 917 9390. And you can self-refer for physio that way. But hopefully you won't need to do that. So all the best.